I'm Betty Casey, editor of Tulsa Kids Magazine, and Tulsa Kids has partnered with the Children's Hospital at St. Francis to bring you important information regarding your children's health. For today's segment, we're welcoming Dr. Johnathan Ledet with Warren Clinic and St. Francis Children's Physicians Dermatology. Dr. Ledet is going to talk about skin and eye protection. So, welcome, Dr. Ledet.
Thank you very much. Thank you all very much for having me.
Okay, let's just start with why parents should be concerned about protecting their children's skin and eyes from sun exposure.
Well, as we know, the sun is very important. It helps plants grow. It helps us be able to get solar panels and free energy and all those things. It's important for parents of all nationalities, I'd like to say, to protect their kids' skin from the sun because their skin can burn. So sunburns and sun exposure, we know, lead to skin cancers over time. So we really want to make sure that that we are able to protect ourselves, because especially when you're young, the frequency of burns we know is correlated with the amount of skin cancers that you're going to have later in life. Not only that, but to mention that sunburns are painful. They're they're uncomfortable for people to uncomfortable for not only adults but kids especially to have to deal with.
Okay, so you mentioned even if your child has dark skin, if my child has dark skin or tans easily, do I still need to protect their skin from the sun?
Yes, so you still need to protect their skin from the sun. So what I like to tell every parent is every skin type will burn. Okay, so the difference is the darker you are, the longer it takes for you to burn. So whether you're a white person, an Asian, an Indian person, or an African American person, a black person, it is important to protect your skin from the sun because you also will suffer sun damage. So I primarily do I do surgery, and I have taken skin cancer off every ethnic background. And that starts from when you're small. Those times you go to the pool, we weren't as diligent as putting on sunscreens, etc.
Okay, so every type of skin can burn.
Everyone.
So what should parents know about protecting their child's skin? What can we do?
So what you should know is, so I always tell parents the actual best sun protection is, I prefer the clothing, right? So because I have a daughter that has eczema, and her having eczema, she is very sensitive to sunscreen. So we can only use what's called physical blockers like zinc or titanium, because the chemical blockers, which work very well, they work very well. However, she needs to, she reacts to them because she has very sensitive skin. So the first thing I tell parents is I like the sun protective clothing. You can tell when my kids are at the pool because they are the ones with the long sleeve shirts. They have the swimsuits that go all the way to their knees. They wouldn't wear the ones that go all the way to their ankle. Otherwise I would have them do that. So we put sunscreen on. It's important to reapply. I get a lot of questions about, what SPF should I use? Okay. So, and I tell parents, I think you should apply the highest SPF that you can find. And the reason for that is there are lots of things that say 30 and 70 are the same. They are the same in a laboratory setting, and they assume perfect use. So most people only put sunscreen on. There have been numerous studies that show most people put it on somewhere between a third and half as much as required. Sunscreen is expensive. So it is very important that we apply sunscreen, we reapply sunscreen liberally. I like the clothing because it never wears off, right? And we only have to protect the areas that are not covered by clothing.
Are there certain times of the day that are safer to be outdoors than other times of day?
Yes. So what you're referring to is something called the UV index. So we live in Oklahoma. Usually around the latitude we are, between 10 and 2, that's when the sun is going to be the most intense, and that's when we want to try to avoid the sun. And if we're not able to avoid the sun during those times, we want to increase our amount of sun protection, either vis-a-vis wide brim hats, sun protective clothing, etc. So this is just very, very important.
Okay, so you mentioned chemical sunscreens and sunscreens that block. So chemical sunscreens are safe?
Chemical sunscreens are safe. Physical sunscreens are also safe. There are, there's been a lot published about sunscreens and some of them being detectable in the blood, but we have not been able to correlate that with anything. So sunscreens are safe. The physical blockers are inert. The chemical blockers are fine. If you have sensitive skin, you want to try to use something that's zinc or titanium. Zinc is actually the best sunscreen because it blocks, we always say zinc blocks from A to Z. It blocks all of the rays that you are subjected to. It also stays on a little better. So I think because it's more tacky. So the downfall with zinc, which companies are rapidly trying to correct, is that it goes on kind of white. So kids, you want to rub it in, so which makes it thinner, and then you get less sun protection.
So we need to apply enough sunscreen.
Yes, ma'am.
And I want to ask you how much is enough, and we want to make sure we reapply it if kids are out sweating or swimming or whatever. And any kind of sunscreen is safe. But going back to how much to use, how do you know how much? Is it on the bottle?
So it's not on a bottle. So it's supposed to be for the average person with the arms, the lower legs, and the chest and back exposed. That would include a female wearing a stereotypical two-piece bathing suit. That would be approximately 1 ounce or about a shot glass worth. So on a kid, that's going to be a little bit less because they're a smaller person. So it's about a shot glass worth that you're going to put. So 1 ounce, or parents would know this as basically the little the cup that you use for different medicines and whatnot. So about one of those 30 milliliters or so, to apply.
And that is quite a bit. So
That's a lot of sunscreen, and sunscreen is expensive, right? So if you have if you're going to apply every 2 hours, you can imagine for a family of 4 going on a week-long beach vacation, if we're going to apply this 2 to 3 hours, 2 to 3 times a day, that can get quite expensive. So the other thing is, just realistically, most parents don't reapply, or most people don't reapply within 2 hours. And since they don't reapply within 2 hours, if you start off with a higher quality sunscreen, as it deteriorates, you're going to be left with more protection than if you started with, let's say, a 30. Because as the studies show, most people don't put it on as thick as you're supposed to.
Okay.
So you also asked me about eye disease. Now, I'm not an ophthalmologist, but the things that we know that the sun. So one, from a skin perspective, the sun can make you burn, right? It also makes your skin age because it breaks down the components of the skin, the elasticity of your skin, and whatnot. That's compromised as we have more birthdays and more sun exposure. The skin becomes it becomes tougher. It loses some of that elasticity. So if you want to look youthful, instead of paying for Botox in 40 years, just sunscreen every day is your best friend. The sun causes aging, not only in the skin, but it also causes the aging of the eye. So UV exposure to the eye, very bright lights causes it causes the sun. It causes different parts of the eye to break down. You can also get a corneal sunburn. So one of the reasons they tell you not to. We recently had the solar eclipse here in Oklahoma, or nationwide. We were able to see that eclipse, and they wanted you to wear those super dark glasses because it was so bright that it could cause. It's kind of like a welder's flash. It can cause some burning of your cornea. So UV exposure also accelerates cataracts as well. So the more sun protection we can have for both your skin and eyes is what we need to keep not only the adults, but especially our little kids healthy.
Absolutely. All right. Thinking of sunglasses or eye protection, can any sunglasses work? Like there's these cute little sunglasses that kids wear, or do we need to look for particular types of protection for their eyes?
Are you so it sounds like you're referring to, do you want polarized or non-polarized sunglasses? So you want sunglasses that are gonna block, it'll say It blocks 96, 98% of UV light. So you want, sunglasses. So like, and most sunglasses now, since sunglasses have been around for a long time, even an inexpensive pair of polarized sunglasses is going to protect yourself from that sun. Just like if you use window films on either your home windows or on your car windows, that blocks most of the UV light. So sun rays are your front glass is what's called laminated glass. Front and back glass, so the sunlight does not penetrate through those, but it does penetrate the side glasses. So that's where having your windows tinted, legally appropriate, of course, is very important to protect your little ones from the sun's powerful rays.
Okay, that's good to know. And I want to talk briefly about infants. Does all of this apply to babies?
Okay, so the official recommendation is that we do not use sunscreen under 6 months of age. Okay, so for those little persons, we need wide brim hats, sun protective clothing, and keep them in the shade. So that's what we should do. If they're older than 6 months, you can use the sunscreen. Like I said, they are safe. Most of the baby sunscreens are actually what we call the physical blockers because they're more inert and they don't react. They're less likely to have your child would be less likely to have a problem.
Okay, good to know. And finally, if our kids do get sunburned, and I know as a parent that it can be very painful and it can be dangerous down the road. What should we do if our kids do get sunburned?
So the first thing is we need to determine how bad is the sunburn. Okay, so if the sunburn is so bad that they're in pain, we should reach out to their primary care provider or to a dermatologist. Sometimes we use topical steroids to help calm down the inflammation. You can use cool compresses. Some people, you want to use an ointment of some sort. Some people use, Vaseline that helps speed the healing of the skin. Some people use Silvadene, but almost everyone has Vaseline readily available. Aloe, depending on which formulation the aloe is in. If it's in, you got to be careful if it's in a gel because sometimes they have alcohols. So if the sunscreen is very robust, we want to reach out to either the pediatrician or to your friendly dermatologist in order for us to get it treated.
Okay, good advice. So if you're worried about it, you should call your doctor.
Correct. Because those sunburns are painful. So, and while I have you here, I would like to address the concept of what do patients call it? They call it like a preemptive burn or something before they go on vacation so they don't burn later. This always comes up. So what I tell patients is that you burning is a protective response. Your skin is trying to protect itself from the sun. That's why you get darker. That's not something that is, if you put on sunscreen, it doesn't stop you from tanning. It stops you from burning because that's where the damage, and as we know, that leads to skin cancers, albeit, 30, 40 years down the road. Basal cell carcinoma, squamous cell carcinoma, and melanoma, of course, as well. So I think it's very important that we, just stress sun protection from an early age. I have 2 daughters and they know as soon as they're going to go play outside, we have a wide brim hat. We have, we have our eye protection, and we also have, most importantly, sunscreen.
So that preemptive sun, I've heard of that, and I didn't know that was still a thing.
So yes, unfortunately, it's still a thing. It does not need to be a thing. It's not something we recommend. My personal bias is that I think that it is important that we I like to start with the creams first, because if you think about like the ear and the nose and whatnot, people won't take the can and hold it up to their ear. So I think starting with the cream first and then setting a timer, a reminder for when to reapply. I think natural breaks work well if you get to the beach or the playground at, let's say, 9 a.m. or something. So sometime at lunchtime, that would be the time we need to reapply that sunscreen.
And you made me think of one last question. We're in the sunny summertime, but this is a year-long thing, right?
Yes. So you want sun protection. So some of the worst sunburns I have seen have been off season on quote cloudy days, right? So you are not protected just because it's a cloudy day does not mean you will not sunburn. It is very important to protect your skin year round. Now in the winter, it's cold outside, and since it's cold outside, we tend to cover up more, and that the clothing affords us some protection that way. So, but yes, we want to, in Oklahoma, you know, our springtime is very pleasant. You go on hikes, fishing, boating at our local lakes, etc. It is very important that we protect our skin, not only in the sun, but in every season. Not only in the summer, but in every season.
Great advice. Thank you so much for talking with us, Dr. Ledet. We've been talking with Dr. Johnathan Ledet with Warren Clinic and St. Francis Children's Physician Dermatology. You can find the complete interview and others like this at tulsakids.com, or you can watch for PJ's Corner in the print issue of Tulsa Kids Magazine. And thank you for all of that great information, Dr. Ledet.
All right, ladies. Thank you all. Y'all have a fantastic day.